A very good afternoon and welcome to our session on the topic dengue fever in children. We are glad to have Dr. Harish, a senior consultant pediatric and pediatric pulmonologist, among us today to help us understand the topic and the importance of each and every detail he is going to mention. The doctor will take us through that more in the session. So if you have any questions, any queries, please post that on the comment section. The doctor will take up all your doubts. So by the end of the session, so stay tuned. Doctor, you have this stage.
Okay. Hi, good afternoon. I'm Dr. Harish. I'm one of the pediatric consultants at Apollo Kalapakam in Chennai. I guess most of the viewers of this telecast they are from Chennai, and now is the rainy season in Chennai, and we are seeing a lot of children with dengue fever. So I'm going to have a quick recap about, or rather, talk about dengue. So dengue fever is a viral illness, usually seen in tropical and subtropical areas of the world. It's a flu-like illness and usually lasts less than 7 days, and it can sometimes be very serious and sometimes very fatal. Now, it is generally and it is always a mosquito-borne viral illness caused by a mosquito called as Aedes aegypti, which is quite notorious. It can cause other illnesses like yellow fever and chikungunya virus. It is a similar family mosquito which can spread these illnesses as well. Previously, dengue fever used to affect only animals, and then it moved on to human beings, and it became a huge strain on the medical and field in the world. So the dengue fever is caused by four strains of dengue virus, all four of which we seem to infect human beings, and they originated into humans 800 years back. The first epidemic was seen in India in 1963, and the first recorded epidemic was in the French West Indies in 1635. And then, when the World War began, dengue fever illnesses started to spread to all parts of the world, and because of the cargo transport and the mosquitoes were transported along with the cargo as well. Now, which places are the greatest risk of catching dengue fever? It's usually the tropical and the subtropical countries. And in these subtropical countries, the urban cities and urban areas are the places where there is a clear water accumulation in man-made containers. Now, how do I catch dengue fever? Now, dengue fever can come to a person when an infected Aedes aegypti mosquito bites the person. Now, these you need to know a bit about these mosquitoes because that is the only way we can prevent dengue fever. The mosquitoes generally have the Aedes mosquitoes generally have a flight of 30 to 50 meters from the place where they are born. They are born from their eggs, and they bite human beings during the daytime, a few hours after dawn, and a few hours before dusk. And they're generally found in the eggs. The female Aedes mosquito lays eggs in clear water containers, and the eggs hatch a few weeks later, and then it becomes into a adult female mosquito. And if this mosquito bites somebody who's already had dengue fever, the dengue virus spreads from that person to another person when the mosquito bites another person. Now, generally, these mosquitoes live in the dark, humid places and behind curtains in households. So, it's extremely important that the clear water containers should be closed near your house, and these mosquitoes uh, generally breed there. So, if you can empty these containers, that's going to be a very useful method of stopping the spread of these mosquitoes. Now, how does the dengue epidemic occur? A dengue epidemic occurs when a huge number of infected mosquitoes bite quite a few number of people around, and because of transport and people moving around places, it spreads very fast from one place to the other. And generally, by the time the person realizes he's got dengue, he's already spread to quite a few people because the first few days of the illness, it just looks like any other viral fever. Now, why do some people get severe dengue fever? Now, if you look at dengue infection, there's something called as primary dengue and secondary dengue. Now, primary dengue is where when a person gets infected, they can get a straightforward fever. They can have lots of symptoms, which I'm going to go through now. And when they get after they recover and when they get infected again with another strain of dengue virus, then what they get is something called as secondary dengue. So secondary dengue can be very serious, and some people, even children, it is very serious, especially in children, and they get hospitalized. So coming to the symptoms, what are the various symptoms of dengue fever? Now, non-severe symptoms, because there is an incubation period of 4 to 10 days, the person after the mosquito bite will not know until the symptom starts, and these symptoms starts usually after 4 to 10 days. That is what the incubation period is all about. So that the person can start having even mild grade fevers in a non-severe dengue or high grade fevers going up to 104 as well. They start having headaches, muscle and joint pains. They have pain behind the eyes. They feel sick with nausea and vomiting. They have swollen glands. They have a rash which usually pales when pressed with a glass. And the symptoms usually last for about 2 to 7 days. And most of them recover without any issues. They just recover with the fever, and a small measles like rash comes up, which can be a little itchy. And then with simple antihistamines, it gets better. Now there are some children who go into dengue with warning signs. A warning signs is it tells us whether that these children can get unwell in the next few days, and they can land up being in the ICU as well. Now, it differs from person to person that these warning signs may develop 3 to 7 days into the illness. They can have severe tummy pains, they can have diarrhea, they can have bleeding tendencies with bleeding gums, with nosebleeds. They can bleed from their skin with the capillaries over the skin. They can have unexplained tiredness, physical restlessness. They can have tummy pains, bleeding gums, and they can also have swollen glands. They can land up having fast breathing as a severe warning sign for dengue. Now, when if these signs are there in children who already have dengue fever, it's extremely important the doctor will admit the child for close monitoring. Most of them get better even after warning signs, and there are some children who get even worse after the warning signs. So they land up having something called as severe dengue. As I spoke before, that severe dengue can happen as a part of secondary dengue as well, and severe dengue can happen once the complications set in for somebody who has had the usual dengue. So with these children, they go into shock, they collapse, they start having bleeding tendencies. So when they get shocked and collapse, they experience other multi-organ failure of the heart, liver, lungs, and circulation. So therefore, we find these children land up getting admitted to the intensive care. Now, when these symptoms develop, it takes a little longer time for these children to recover, but sometimes some children even die because of severe dengue. Now, what is recovering from dengue like? Usually, in olden days, it used to be called as a break bone fever. So most of the children are very tired, lethargic when they recover, and most of the non-severe cases they recover completely. And those with dengue warning signs also recover, but sometimes those with severe dengue can get even worse. So there are other conditions which look like dengue, but unless we do a blood test for dengue, we probably cannot confirm. So either a blood test at 2 or 3 days, or even at 5 days of fever is done, and the NS1 antigen is generally positive, and IgM, which is antibody for dengue, that can also be positive for dengue. There are other blood markers which can support the diagnosis, like low white cell count with a high hematocrit, and low platelets. Generally, people think it's all about platelets. It's not about platelets alone. It's about how well the hydration the child is. So, if the child drinks well, if the child is well hydrated, then the platelets does not matter. It usually falls down to 50,000 and then it automatically comes up. So there is generally a misnomer that assumption that you start giving papaya leaf extract and it's going to help for the platelet count. No, actually, the body kicks start a response as soon as the white cell count starts getting better. The platelets also improve. So it's just not all about platelets. It's just about how the child is. What is the hydration? Is the child drinking well? Is the child having diarrhea? Are we able to hydrate the child or not? So there are lots of things we look into, and it is not just about platelets. So how do we treat dengue? Now, non-severe dengue children, most of them they recover at home. We don't have to admit all children with dengue, and they just have to take simple antipyretics, that is paracetamol for fever, avoid certain medicines like brufen and mephtal, and make sure the child drinks well, and eventually all the other symptoms like headaches, muscle pains, all this get better. And those children with warning signs, they are also closely monitored. They are given symptomatic treatment, and they made sure that they don't go into further dehydration. Now, how do children with dengue, severe dengue, recover? They also get, once they get admitted, they start having fluids and for support of their body blood volume, and they also start having things like blood products, and they also get treated for secondary bacterial infections. Now, it's extremely important that to know that there are no specific medicines for dengue. It is just treated by giving only supportive treatments. Now, because there is no medicines to treat dengue, because we don't have sometimes enough um, backup in terms of patient being monitored, not in hospital settings. The dengue can get even worse, and children can land up in ICU, but most of them do recover. So, if there is no treatment, it is extremely important to know whether we have a vaccine for dengue. Now, we know that there are four strains of dengue virus, and there is a vaccine that's being developed and is currently being used in South American countries. And this is a vaccine for dengue, which is for a single strain. So there are problems where there's still more further trials are going on. If we administer this vaccine and the person gets infected with another strain of dengue virus, will the immune cells be on overdrive and a lot of further problems can it occur? The trials are going on. The studies are still going on. So there is no full-fledged dengue vaccine yet, but there is a vaccine being used in South American countries. Now, how can I avoid catching dengue? The most and easiest thing is to not to travel in a zone which is quite infected with dengue all around. But in India, we can't avoid it. Every nook and corner we find there is mosquitoes, and they all develop because of poor sanitary conditions, and the building materials are thrown here and there. So um, we have to land up having measures to prevent the multiplication of mosquitoes. The most important thing is environmental modification, and the next important thing is environmental manipulation. So, what do you mean by environmental modification? The water supply that's been given to all to people should be in closed water pipes, so that mosquitoes don't breed in the stagnant water. And waterproofing overhead tanks is very important. So the overhead tanks has to be covered so that the mosquitoes don't enter and start breeding. And an environmental manipulation where coming down to domestic water stores, it should be all the pots and vessels which contain water should be emptied and should not be allowed to collect water even more. And then individual measures people can use by using DET um, mosquito repellents, and and it is better to for children to be fully clothed, especially during a rainy season where there's a lot of mosquitoes. Fully clothed shirts, fully clothed pants, all this can help preventing mosquito bites. Okay. I think there are no questions. Any questions? Thank you. Thank you.